Hi, I'm Dr. Jacob Teitelbaum, board-certified internist and a practicing physician for over 30 years. In this segment, we're going to teach you how to eliminate migraine headaches naturally and also the best mix of medications to eliminate an acute migraine. Now, migraine headaches plague millions of Americans, and the cause is still uncertain. It seems that there is a mix of changes in nutritional status, muscle spasm, and also blood vessel contraction and serotonin levels that contribute to the illness. Although there is much controversy over the cause of migraines, the research is very clear that you can be headache-free using a mix of natural therapies. Now, I'd like to start by looking at what you can do to eliminate an acute migraine. When you have one of these nasty headaches, you want to make it go away, and prevention is nice, but you need something now. There are two natural treatments that can be quite effective. One is an herb called Petitolax or butterbur, and I would use a Petitolax form. And you can use 100 milligrams every hour for up to 3 doses, and this will often eliminate an acute migraine. The single most effective treatment for an acute migraine, if you do go to the emergency room, is to simply give 1 to 2 grams of magnesium intravenously over 10 to 15 minutes. Now, the emergency room physician will not have heard of this for a very important reason, because the magnesium costs a total of 10 cents. And there's nobody that's going to pay to get those research studies to them. So what I'd recommend, you can go on my website at vitality101.com or look at my book, Pain Free 123, and it will have the scientific references on the use of magnesium. Perhaps if you go to the emergency room, you can take that to the physician, and they may be open-minded enough to try it. The intravenous magnesium eliminates migraines within 15 minutes over 85% of the time, with minimal side effects and without that migraine recurring, as opposed to when you get the narcotics in the emergency room, and they can be used along with the Demerol. Now, the other things you can do at home, most of you are familiar with Imitrex and Emerge and other medications that can be very effective for an acute migraine. But it's important to know that as soon as you get pain and sensitivity around your eyes and ears, the Imitrex is only going to work in 13% of cases. So if you use the Imitrex early in the attack or Emerge or any of the cousins to that medication, it's likely to be effective. But by the time you get tenderness around your eyes and ears, you want to switch to other treatments. Either use a Petitolax, or you can simply use Excedrin migraine, which is a mix of the caffeine, aspirin, and the Tylenol. Interestingly, in head-on studies of people with migraine headaches, that combination has been shown to be equally effective as Imitrex. Your doctor will not know about that research because the medication is cheap and nobody will pay to get them that information. Let's talk for a moment about what you can do, though, to prevent the migraines from occurring. It was interesting when I was on CNN a little while ago, the segment ahead of mine was using major face surgery where they cut out big chunks of the face muscles to go ahead and decrease migraine headaches by 50%. God only knows how disfiguring that was and how expensive. I had to bite my tongue when I went on for my segment because it's tacky to diss the person who came on right in front of you. But by simply taking vitamin B2 or riboflavin 400 milligrams a day, double-blind studies have shown that you can decrease migraine headaches after 6 weeks by 67%. And in fact, more recent studies show that even a lower dose, like 80 to 100 milligrams, can be equally effective. In addition, taking magnesium by mouth and other B vitamins like B12 will decrease the frequency of migraines. So a simple thing to do is to get a vitamin powder called the Energy Revitalization System vitamin powder. It's made by Enzymatic Therapy. It can be found on my website and most health food stores. Or you can get the components separately. In addition, taking coenzyme Q10 and also the Petitolax can also prevent migraine headaches very effectively. You'll find that by doing these things for 6 weeks, your migraines will usually go away. For those of you who have the migraines mostly around your periods, however, you need to be aware that the changes in estrogen can be a potent trigger. My book, Pain Free 123, will talk about in depth how to take care of that problem. Migraine headaches are very easy to prevent naturally, and also not that hard to get rid of during an acute attack. So you don't have to suffer. This is Dr. Jacob Teitelbaum wishing you great health.